ECDR is our electronic controlled drugs register. It mirrors the traditional paper registers and paper ordering books in an electronic format.
The electronic controlled drug register is more than just a drugs register. It acts as a way to also order controlled drugs, process controlled drugs. It acts as an auditing tool for the entirety of how controlled drugs are managed within a trust.
Prior to this, we used a paper process to document our controlled drugs. There were lots of downsides to this. So staff would scribble out in the registers. It was impossible for us to tell where our stock was across the whole organisation. And when we were auditing, we would have to actually go around all the wards and find out what was where. And that meant that it was very time consuming. The ECDR register solves all those problems.
The impact for staff has been really beneficial, especially in terms of nursing being freed up with more time and having to spend less time ordering and coming down to pharmacy to wait for CDs.
I believe ECDR has been beneficial to nurses because it ensures accurate record keeping and ensures patient safety.
Our staff prefer ECDR to our previous paper solutions simply because our workload is a lot more manageable, everything arrives in a much more timely manner, and having to investigate anything involves looking through one simple compact area as opposed to having to trawl through various paper-based sources of information.
ECDR is a massive change to our system and something that we should have done years ago. Good example is when you're on call, you get an urgent call, really poorly patient who requires a controlled drug and it's an unusual one. I can tell at a glance what ward's got that and direct the staff to that ward. That means we're not wasting staff time and also we're getting patients their care quicker.
Overall, the impact of ECDR has been rather positive in our trust. It's greatly improved patient safety, so it allows clear, concise documentation to be in place for anything that has occurred involving the use of controlled drugs.
Looking at next steps in terms of how do we make things better. Because we're a very digitally enhanced trust, there's lots of digital systems requiring username and password, and having to remember those and input them into each individual system can sometimes be slightly frustrating for staff. So looking at next steps with ECDR, could we look at tap and go functionality and again speed up that process and access to the system for staff?